Hi, hello, welcome back to our channel. So today we are going to discuss the yesterday's MCQ. So before going into the explanation, let me tell you the today's MCQ. So the MCQ question is the placement and direction of proximal grooves on 3/4 crown on molar tooth. So the options are A, placed in buccal half and with buccal and lingual divergence. B, placed in buccal half with lingual to buccal divergence. Option C, placed in the center of the crown with buccal to lingual divergence. Option D, placed in lingual half with lingual to buccal divergence. So comment your answers in the comment section below or in the Instagram page. The special mention will be made for the correct answer. So come, let's go into the yesterday's MCQ. So yesterday's MCQ was the gingival finish line on a tipped molar should be. So the answer for this question is option C, knife edged. So the reason behind the answer is usually when we make a crown preparation for the abutment, we will make in the sense like the crown which is placed over the abutment will be in the long axis of the tooth, where the tooth will be straight and the crown will be straight. So clinical we will have a straight crown which is in the occlusal plane. But when it comes to a tipped molar, we usually don't make the crown in the long axis of the tooth. Instead, we make a crown which is equivalent to the occlusal plane, where the crown is clinically seen as a straight tooth. So the abutment tooth will be clinically viewed as a straight tooth after the placement of the crown, but in X-rays we will note the tooth is tilted. So when we go for a tooth preparation for a tilted tooth, what they usually do is they will have a very minimal amount of reduction in the cervical area, that is in the finish line, and they will have a increased reduction towards the tilted side and a minimal reduction in the non-tilted side. That is, if we have a case similar to this picture where the molar is tilted mesially, the long axis of the tooth is different. So we have to mark the actual long axis of the tooth, and we have to prepare the crown, where the mesial side of the tooth will be reduced little bit more than the distal side to equalate the crown prepared, so that the crown is clinically viewed straight in the alignment of the tooth. So in this case, we have increased reduction of tooth structure and very minimal accessibility of the tooth. We will end up in making a knife edged finish line. As I said, we have an increased reduction of crown, then where come we will be having a retention for the crown to withstand the force. So for that we will be making a telescopic coping which acts as a core buildup for the crown which is prepared. So above that we will be taking an impression and doing a telescopic crown. So the crown which is fabricated for a tilted molar is known as telescopic crown, and telescopic coping is not the only option for the retention of the tilted crown. We can just add the grooves for the retention. So usually they will give a reversed 3/4 crown for a tilted molars. So what is this reversed 3/4 crown? So this reverse 3/4 crown and 3/4 crown, and even we have 7/8 crown. So all these kind of crowns will be discussed in the next video. And knife edges are given mostly when the finish line is given in the cementum, or if the finish line is in the inappropriate area where the accessibility is very minimal. So when we have a tilted tooth, the access is very minimal towards the mesial surface, and we will have a exposed root surface. So the finish line or the measurements are not so appropriate towards the geography what we usually have for a normal tooth. So for this tilted tooth we have totally different kind of tooth preparation. So we have chamfer and shoulder finish lines, where most commonly used finish line for PMF crowns or whole zirconia crowns, or it may be a metal ceramic crowns. So for all these we will highly use the shoulder finish line. So if you like this video, please do like, share and subscribe to this channel, and do comment the answers for the question which is mentioned in the start of the video, and let's have a discussion tomorrow about this.